Hi there. You visit a patient with congestive heart failure. Their weight is up, their ankles are swollen, and they're more short of breath than last week. Now the question is, how do you document this in a way that supports medical necessity and demonstrates skilled nursing? Instead of guessing, use this simple framework: the condition, the risk, skilled action, response, and continued need. So let's walk through a real CHF visit. Imagine you're seeing an 82-year-old patient with congestive heart failure. During today's visit, you discover that the weight has increased 4 pounds in the last 5 days. Bilateral ankle edema has gotten worse, increased shortness of breath when walking to the bathroom, and patient reports eating restaurant meals several times this week. Many nurses would document those findings and stop there, but experienced home health nurse knows those findings tell a much bigger story. So, in step 1, ask yourself, what is the most significant clinical issue today? Today's condition is the recent weight gain, the increased edema, and the increased dyspnea. These findings may indicate worsening fluid retention. That's the clinical issue that matters the most. So step number 2 is risk. Ask yourself, what bad outcome could happen if this condition continues? Well, this patient is at risk for congestive heart failure exacerbation, respiratory distress, possibly an upcoming emergency room visit, and potentially hospitalization. This is where many nurses miss an opportunity. Weight gain is really not the story. Hospitalization risk really is the story. So step number 3 is skilled action. Why was a nurse needed today? Well, a family member can notice swollen ankles. A nurse can assess the cardiopulmonary status, interpret symptom changes, evaluate medical compliance, and identify signs of fluid overload, reinforce the disease management, and determine if physician notification is needed. That's skilled nursing judgment. Today, skilled actions may include the cardiopulmonary assessment performed, weight trends evaluated, lung sounds assessed, medication compliance reviewed, sodium and fluid restrictions reinforced, and physician notified of symptom changes. And then step number 4, the response. What happened because of your interventions? Maybe the patient states, well, I didn't realize those restaurant meals had so much sodium. Maybe the patient correctly explained when to call the physician, and maybe they require additional teaching. Document the response. This shows the impact of your skilled services. And then step number 5, the continued need. Why are future nursing visits still necessary? Well, the patient continues to demonstrate unstable congestive heart failure symptoms, ongoing risk of fluid overload, and need for skilled assessment, need for continued disease management education. That supports the ongoing skilled nursing services. So, putting it all together, now let's turn the visit into a clinical story. The patient noted to have a 4-pound weight gain over the past 5 days, increased bilateral lower extremity edema, and worsening exertion of shortness of breath compared to a previous visit, and skilled cardiopulmonary assessment performed, lung sounds assessed and weight trends reviewed, medication adherence evaluated, and medication reinforced regarding sodium restriction, fluid management, and daily weight monitoring, and symptoms reporting parameters. Physician notified of symptom changes for further evaluation. Patient verbalizes partial understanding but continues to require reinforcement regarding dietary management and congestive heart failure self-monitoring. Continued skilled nursing required due to ongoing risk of congestive heart failure exacerbation, fluid overload, and hospitalization. So the Medicare reviewer perspective on this is the condition. Well, they know that it's the weight gain, the edema, and the dyspnea. The risk is the CHF exacerbation and possible hospitalization. The skilled need, well, assessment, interpretation, teaching, physician communication. The skilled intervention, disease management education and clinical evaluation. And then the continued need. Patient remains unstable and at risk. That's exactly the clinical story Medicare expects to see. So in closing here, the next time you're documenting a CHF visit, don't focus on just filling in the boxes, focusing on answering these 5 questions. What's the condition? What's the risk? Why are nurses needed in the first place? And what skilled action occurred? Why are future visits still necessary? When you use this framework, your documentation naturally supports skilled need, medical necessity, and an ongoing need for home health services. And that's how an experienced home health nurse thinks before they start typing their note. Hope this has been a help for you. Consider subscribing. There's additional information on the YouTube channel description. Hope you have a nice day.